Fifth nerve.
Fifth nerve is the trigeminal nerve, the fifth cranial nerve.
Functions.
The fifth nerve has two functions. One is general sensory, one is motor.
Nuclei.
As the nerve has two functions, it should have two nuclei. The motor nucleus is known as the motor nucleus of trigeminal nerve, while the sensory nucleus has three parts. One is mesencephalic, principal part, and the spinal tract part.
Location of nuclei.
The motor nucleus is located in the pons, while the sensory nucleus is a big nucleus. It starts from high in the midbrain, the mesencephalic part. The principal part is in the pons, while the spinal tract part goes from the medulla even into the spinal cord.
Point of origin.
Well, this nerve originates from the lateral aspect of the pons, or you can say anterolateral.
Relation to dura.
Okay, this nerve is present in a fold of dura, which is known as trigeminal cave or even Meckel's cave.
Divisions.
It has three divisions: ophthalmic, maxillary, and mandibular.
Functions of divisions.
The first one, ophthalmic, is purely general sensory. Maxillary is also purely general sensory, while the mandibular division is general sensory as well as motor.
Relation to a sinus.
Relation to a sinus, yes. The first two divisions, ophthalmic and maxillary, are passing through the lateral wall of the cavernous sinus. The ophthalmic division is just inferior to the trochlear nerve, while the maxillary is just inferior to the ophthalmic nerve.
Openings.
Oh, a lot of openings. The ophthalmic division passes through the superior orbital fissure and enters the orbit. The maxillary division passes from the middle cranial fossa in the cavernous sinus to the foramen rotundum, then to the pterygopalatine fossa, and then through the inferior orbital fissure into the orbit. In the floor of the orbit, it passes through a groove, makes a groove which is known as the infraorbital groove, then into the infraorbital canal, and emerges on the face through the infraorbital foramen in the form of infraorbital nerve. While the mandibular division of trigeminal nerve, it passes from the foramen ovale and enters the infratemporal fossa.
Muscle supply.
Okay, the mandibular division of trigeminal nerve supplies 7.5 muscles. 4 are muscles of mastication: the temporalis, the masseter, the lateral and medial pterygoids. 1 is muscle of the soft palate, which is tensor falae palatini. 1 muscle of the middle ear, tensor tympani. 1.5 muscle of floor of mouth, which is mylohyoid, and anterior belly of digastric.
Embryology.
Embryology, yet just take it as a tip. All of these muscles which I just named, they are derived from the first pharyngeal arch.
Detail.
For details, you can just follow my YouTube channel for a complete video, or even in the description and even in the comment section.
Thank you so much.
You're welcome.